Now we're going to split the sort of the conversation really into three parts and kick off with the impact and repercussions of COVID-19. It has disrupted cancer care services across the world, and there is obviously a concern that the pandemic will impact patient outcomes, including patients with ovarian cancer as well. So Tracie, if I can come to you first, just to talk about the impact that COVID-19 has had on ovarian cancer care and of course patients as well.
I think one of the biggest impacts has been on getting our ladies in for that early diagnosis, which we know is the nirvana and the wish that we have for all ovarian cancer patients. So often a woman doesn't go to her GP with her subtle symptoms of ovarian cancer, and so we pick up at a later stage. She really hasn't gone to her GP during COVID. Number of reasons. One, she doesn't want to bother the GP. Two, the GP hasn't got the time. They want to make the time, but we've had shorter amounts of GP appointments. And four, she's just denying those symptoms because she's worried about everything else COVID. And finally, yes, there have been some audio consultations for patients, and we've been able to do photo consultations, say dermatology. You can't pick up those subtle nuances unless you have that woman in front of you. It's really been hard.
Now, in some of my research for this discussion, the term biomarker status came up quite a lot, as if it was sort of something that we all should know about. And in my ignorance, I didn't know enough about it. So, Tracie, if I can ask you on this point as well, what the impact of COVID-19 has been on the timeliness of biomarker testing.
Thanks, Hannah. Yes, it's super tricky at the best of times. So biomarkers, what blood tests can we do, or what other tests on tumour, for example? Can we do bits of tissue biopsies, as how we collectively call them? And we're looking particularly when we look at family history, or we're looking at concerns about the genetic implications. We know that a woman with a changed and alterated BRCA gene is at a higher risk. So a biomarker would be knowing what her genes are. Another biomarker would be a CA125, a super simple blood test to do. But she's got to get to her GP to have that blood test done. And as we were saying earlier, she's not getting there. To have the BRCA test done, she's got to have counselling and consenting by a nurse like myself or genetic counsellor, and there simply hasn't been the time or space to see her. It's been a real problem.
So how have you mitigated that within your profession?
So I have to say that I've been very lucky in the West Country of England, which isn't London, for those of you that aren't in the UK. So I work in the Bristol area, which is lower down in the patch. And actually what we've been doing is we have been using nurse-led services to do counselling and consenting for BRCA testing. So that's what I do, instead of having to send our patients out to clinical genetics. And the GPs have been doing blood tests and sending them in. That's, of course, when there are blood bottles available, because that's another problem that we have in our country at the moment.
Of course.
So, yeah, it has been, in all honesty, Hannah, sometimes we haven't mitigated, and our ladies have presented later across the country. There's no getting away from it, sadly.
And where you have seen missed opportunities for early intervention, things like that, how have you mitigated that, or how can we learn from that in order to prevent it in the future, or improve the stats for the future?
So there's an enormous amount of learning, and we've been auditing and evaluating across the world. And here in the UK, we have a research piece called UK GOGS, and where we are looking at across the country the fallout of not diagnosing our patients as early as possible. And that audit will be released on a regular basis. And so as the British Gynaecology Cancer Society, which is a multidisciplinary group, so nurses like myself, surgeons, oncologists, the whole multidisciplinary team, we're looking and learning and saying, we need to get women to come to us sooner. It isn't a silent cancer, it whispers. Irma will tell you that.
Dave, I want to bring you in on this point, because Tracie's talked so kind of with such clarity and passion there about the obvious gaps that there are in the system at the moment, and I'm wondering how the industry, how healthcare systems, how patient groups, and we'll come to Clara to talk more about that in a moment, but how as a whole holistic approach we can support the ovarian cancer community to sort of address all of these gaps.
Yeah, thanks, Hannah, for the question. And I think that Tracie really paints the unfortunate reality that women across the globe are struggling with. To put a few more statistics just to underscore the importance of what we need to be doing here. We know in the United States, for example, that new diagnoses in ovarian cancer and indeed across multiple cancer types were as much as 30 to 50% lower during COVID than pre-COVID times. So it's not that the cancer has gone away, it's that it's not being diagnosed. And the reason that that is such an important issue is, as Tracie says, the better outcomes are always the earlier disease is diagnosed. And so that is really the key and the imperative for what we need to be working on and doing. There's also unfortunately been a decline in enrollment in clinical studies. So what you see is not only are we not diagnosing it as early as we need to, but we're not then getting, as a result, women into studies where they can get access to the most innovative therapies that hopefully, lead to the best outcomes. So what are we doing about it? So that's part of the question that you pose. I think the silver lining of the pandemic, Hannah, has been that public-private partnership is actually something that we are seeing a lot more receptivity to. We work together with the WOCC, along with others, on a campaign called New Normal, Same Cancer. It was a program entirely focused in on how do we actually get out a very simple message. Don't wait, contact your doctor. It's a global campaign that we have. We now believe we've reached over 1 billion people with this. And so it's an example of just the need for education and vigilance, and for us to get a message that really patients need to take control of their own management, because really what we're talking about is something that this is a public health cry, right? We're actually asking for people when they are otherwise healthy to be making sure that they are continuing to get themselves checked up. And this is also true for those with risk factors especially. So these are some of the key things that we've been working on, and I hope we can do more of it.
Dave, you mentioned the WOCC, the World Ovarian Cancer Coalition, and we have the CEO, Clara, with us for this discussion as well. Clara, tell us a bit more about your main concerns when it comes to the impact of the pandemic on ovarian cancer care and diagnosis.
Sure. So I think one of the things to remember is that ovarian cancer is already a very challenging cancer when it comes to diagnosis. So even if you take COVID out of the picture, you still have women who are very often diagnosed at a later stage of the disease. So we are already dealing with something that's particularly challenging. So when you bring something like COVID into the picture, it just really multiplies greatly the challenges that we're facing. And we hear from our patient organizations from around the world. You are correct when you said, different parts of the world are in different stages of the pandemic. But there's a consistent message that comes back from everywhere in the world, which is a concern about women not acting on symptoms, about, being too frightened or afraid to go into the healthcare system to seek input. We talked about, women not being able to see their primary care physician in person, and that's a real challenge because of the nature of the symptoms. So, and when you bring COVID into the picture, symptoms are also being kind of attributed to you've changed your eating patterns, you're experiencing a lot of stress and anxiety because you're homeschooling your children, and it's sort of all of these things. So it adds a whole level of barriers that women will face when they do have concerns. And we know that women experience symptoms. We did a big study in 2018, over 1,500 women from 44 different countries, and 90% of those women reported that they experienced symptoms in advance of diagnosis. So those symptoms are there. So I think the delays in diagnosis, it is just imperative that women who are diagnosed with ovarian cancer have access to clinical trials. We must accelerate and ensure that women are receiving the proper genetic testing and screening to sort of move their treatment along. So, but the very, very first kind of point is you have to get a diagnosis before you can get treatment, before you can get to a clinical trial. And we are certainly seeing a real kind of legitimate concern about the impact of COVID-19 on that process.